It's day 2 post-islet cell transplant, and I'm going to try to answer some of the questions that you guys have. In this video, we're going to talk about the number one most often question that I get asked, which is, how did you get into this clinical trial? I found this trial about 1.5 years ago, maybe a little longer than that, on a trial website. There are a bunch out there that talk about clinical trials and keep up with all the information. So I found information on this trial, saw that it was University of Chicago, started going through and doing my own research on it, and then I found a place where I could apply for it online. After I submitted my application, I had a couple of phone interviews to make sure that I met the criteria for the trial. It's obviously very, very specific, and every trial is different. So if you apply for a trial and you don't meet the criteria, don't let that get you down. There are a whole bunch of really cool trials out there, but I did meet the criteria for this trial, and so I did a couple of phone interviews, making sure that I was the right fit for this study. After that, I flew to the University of Chicago last May, and I was here for 5 days doing testing all day, every day, scanned every organ, tons of blood work, lots of different scans, EKGs, all the things, making sure that number one, I'm healthy enough to participate in the trial, and that number two, they were using all of those tests to create a baseline for me so they can measure the trial results against that. Once I passed that part of the check and everything was good to go, I had to get letters from my dentist, my optometrist, and my gynecologist, and any other doctor that you normally see, saying that you are healthy on their end and good to go for the trial. Then I came back in October of last year, and I was here for another week and did 3 rounds of an immunosuppressant called thymoglobulin. It's rough stuff, and that is what you have to take, and then a month later you get to go on the transplant list. So I did that in October, and then the last week in November, right before Thanksgiving, I went on the transplant list for islet cells. Then I got the official call this past Sunday, flew up Monday morning, got my first round of the trial drug on Monday, had my transplant on Tuesday, was recovering yesterday. I've got a video from yesterday, and then here I am 2 days post-transplant, feeling really, really good. For the next 4 weeks, I will get an IV infusion once a week of the trial drug, tegoprubart. It takes about an hour. It's really cool. Unlike the traditional drug, tacrolimus, that is used for anti-rejection, tegoprubart doesn't come with a lot of those nasty side effects that you have, things like kidney damage, toxicity to islet cells. Tegoprubart has shown none of those. And so I've already had several rounds of it, feeling really good. I'll do it once a week for 4 weeks and then every 21 days after that. If everything goes for me like it's gone for the other patients, I should be completely off insulin within about 4 or 5 weeks. And I can't imagine what life will be like to not have the highs and lows of diabetes and the constant mental load and all of the physical things that come with it, and trading all of that for an every 21-day IV infusion is, I truly can't fathom it and feel just really blessed and really excited. So I hope you guys are excited, and I'll keep you updated as we go along. You can ask me any questions, and there's brighter days ahead for all of us.